Augustus Fernandez. I'm presenting my Schedule 2 presentation on the opioid crisis for Nursing 615. To begin this introduction, Schedule 2 and controlled substances play a critical role in modern healthcare, particularly in management of moderate to severe pain and attention-related disorders such as ADHD. Opiates and stimulants within this classification are widely prescribed and when used appropriately can significantly improve patient functioning and the quality of life. Nurse practitioners are increasingly responsible for prescribing Schedule II medications across a variety of clinical settings, including primary care, psychiatric, pain management, and acute care. At the same time, they must navigate the realities of the ongoing opiate epidemic and the rising misuse of prescription stimulants. This presentation will examine Schedule II opiates and stimulants, focusing on their pharmacological mechanisms, public health implications, and the challenges associated with safe prescribing. Particularly emphasis will be placed on the role of nurse practitioners in placing therapeutic benefits with patient safety, regulatory compliance, and community-level harm reduction. Throughout this presentation, emphasis is placed on clinical decision-making, patient safety, and regulatory compliance. In addition, evidence-based prescribing strategies are highlighted to ensure that nurse practitioners are using current research to guide their practice. Understanding not only how these medications work, but also how prescribing patterns influence misuses and overdose risk is essential for safe and effective care. By meeting these objectives, these practitioners strengthen their ability to prescribe Schedule II medications responsibility while fulfilling professional, ethical, and legal obligations required for licensure and clinical practice. According to the Controlled Substance Act, Schedule II medications are classified as substance with accepted medical use but high potential for abuse and dependence. This classification includes most prescription opiates and stimulants due to their strong effect on the central nervous system reward pathways. Schedule II medications occupy a unique regulatory space. Unlike Schedule I substances, they have a legitimate therapeutic value and are commonly used in clinical practice. However, their abuse potential necessities controls include limit on refills, detailed documentation, and close monitoring. Their safeguards are intended to reduce misuses, diversions, and inappropriate prescribing. For nurse practitioners, prescribing Schedule II medications require strict adherence to DEA regulations, state laws, and institutional policies. Failure to comply with these requirements can result in disciplinary actions, loss of licensure, or legal consequences, making regulatory knowledge an essential component of advanced practice. Opiates exert their analgesic effects through the opiate receptor activation in the brain and spinal cord. While effective for pain, these same receptors are responsible for respiratory depression and reward signaling, increasing the risk of misuse and overdose. Repeated opiate exposure leads to significant changes in the brain. These areas of the brain are responsible for reward processing, motivation, and stress responses. Over time, opiate uses increase dopamine release, reinforcing drug-seeking behavior and creating strong psychological dependencies. As tolerance develops, patients require progressively higher doses to achieve the same analgesic effects. Synthetic opiates such as fentanyl bind strongly to opiate receptors and intensify these neurobiological effects. Due to their potency, overdoses involving synthetic opiates may require higher or repeated doses of Narcan for reversal, further increasing the risk of fatal outcomes. In addition to pharmacological potency, overdose risk is influenced by both patient-specific and prescription-related factors. Large studies demonstrated that the concurrent use of opiates and benzodiazepines more than doubles the risk of overdose. This finding underscores the importance of thorough medication reconciliation and ongoing monitoring by nurse practitioners. Understanding how synthetic opiate interact with other medications is critical for preventing adverse outcomes and guiding safe prescribing practices. The article from Weiner identified multiple patient-level factors associated with opiate overdose following the initial prescription. Older adults, particularly those aged 75 years old and older, are increased risk due to age-related changes in their metabolic system and comorbidity conditions. In addition to patient characteristics, the features of this initial opiate prescription significantly influences the downstream outcomes. These findings emphasize the importance of conservative dosing strategies, careful patient selections, and early assessment with initiating opiate therapy. Prescription characteristics strongly influence overdose risk. Overlapping opiate and benzodiazepine use more than doubles overdose risk, highlighting the critical role nurse practitioners play in medication reconciliation and coordination of care. Although opiates receive the most attention, Schedule II stimulants can also significantly abuse potential. Misuse of stimulants may occur for academic performance enhancements or recreational purposes, further complicating prescribing decisions. Schedule II stimulants activate dopamine reward pathways similar to opiates, which contributes to their potential for misuse and dependence. As diagnosis of ADHD increase, so does access to prescription stimulants, raising concerns about diversion and non-medical use. Nurse practitioners must carefully differentiate between legitimate therapeutic use and misuses. Ongoing assessment for diversion, psychiatric destabilization, and substance use disorder is essential, particularly in younger population and patients with comorbidity mental health conditions. Price highlights the complexity of opioid prescribing, noting that nurse practitioners frequently face competing pressure to manage pain while minimizing misuses and complying with regulatory requirements. National survey data indicates the greater exposure to opiate education correlates with reducing opiate prescribing. However, gaps remain in provider knowledge, particularly regarding abuse deterrent formulations. Despite increased awareness of the opiate crisis, many providers report insufficient training in opiate pharmacological and abuse deterrent strategies, which may contribute to unsafe prescribing practices. Providers exposed to opiate education were significantly more likely to reduce prescribing over time, highlighting the importance of maintained pharmacological education. The article from Price found that the providers with greater exposure to opiate education were significantly more likely to reduce opiate prescribing, supporting the Board of Nursing requirements for enhanced pharmacologic education. PDMPs enabled NPs to identify multiple prescribers or pharmacies, thereby reducing the risk of prescription drug diversion. Evidence supports using the lowest effective dose and avoiding long-term opiate therapy whenever possible. Evidence supports the use of PDMP, conservative dosing, and avoidance of high-risk medications combination as effective strategies for reducing overdose risk. Patient education is essential in reducing misuse and overdose risk. Narcan co-prescribing is especially important for patients receiving high-dose opiates or concurrent CNS depressants. Patient education is a critical component of harm reduction. Counseling patients on risk and overdose prevention improves safety and aligns with the best practice in Schedule II prescribing. By engaging patients as active participants in their care, nurse practitioners can reduce misuses and improve adherence to treatment plans. Education empowers patients to recognize warning signs and seek help early. Nurse practitioners are ethically obligated to protect both individual patients and the broader community. Responsible prescribing, continuous education, and adherence to evidence-based guidelines are essential components of professional practice. Balancing benefits, non-maleficence, and justice requires careful consideration of both therapeutic benefit and potential harm. Ethical practices extends beyond individual encounters to include stewardship of public health resources. In conclusion, Schedule II controlled substances remain necessary tools in clinical care, but they demand careful assessment, education, and monitoring. Opiates and stimulants present unique risks that require advanced pharmacological understanding and oversight. All nurse practitioners are uniquely positioned to reduce misuses and overdose through evidence-based prescribing, patient education, and ethical practice. By integrating current evidence into clinical decision-making, nurse practitioners play a vital role in addressing the ongoing substance misuse crisis. Thank you.